My name is Natalia, and I'm a training representative for BioOil in the UK and Ireland. And today we want to explore the topic of self-care and talk about empowering healthcare professionals and patients to manage and care for scars and stretch marks. How many midwives out of our group are there? Okay. And are you health visitors or? Yeah. Amongst other things like weight, scars and stretch marks can have a big impact on body image. And our research shows that patients want to get more advice from healthcare professionals on scar and stretch mark management. And healthcare professionals want to improve the care provided to patients. But currently barriers exist in this area, which blocks kind of developing the care in the area. The government is really encouraging healthcare professionals to encourage patients to self-care, so it's a big topic at the moment. In terms of the aims of the session, we want to review the latest thinking of the impact of scarring and stretch marks. So we want to encourage you to think about what that impact can be and what it might mean for some patients. We want to share the knowledge and best practice, where we will share some real practical advice. And we want to understand your point of view. So we want to get you a little bit more involved in the session and interact with you. And we also want to provide guidance and practical advice, so present some tools available in place to help you manage scars and stretch marks for your patients, and give you tips of how to do that. Firstly, I want to introduce you to Audrey Walker, Senior Midwifery Lecturer at University of Greenwich, and also a inpatient services matron at King's College Hospital. Audrey has years of experience and knowledge to share with you today, so I will let her take over for the first part of the session, and I'll join you later on. Hope you enjoy.
So I don't know if any of you have seen the report that came from the government. It's called Two for the Price of One report. It was published last June. Has anybody seen it? And it was looking at body image in pregnancy and beyond pregnancy. We all know, as midwives and health visitors, student midwives, soon to be midwives, that pregnancy can be a time of discomfort, it can be a time of anxiety for women. And in particular, one of the issues that sometimes we trivialise or we don't take as seriously as we should is the impact of body changes or changes in pregnancy that women feel very strongly about. You know, we have the media, we have the press, we have the era of celebrity where women are getting pregnant, delivering, and then bouncing, springing back, I should say, to their pre-pregnant weight and size and shape. And as we know, those of us that maybe are mothers, and those of us that are in practice, we know that doesn't happen in reality. So body image concerns are widespread. We have to address them during pregnancy. We're not very good at addressing them during pregnancy, but we also need to give women realistic expectations of what to expect in the postnatal period. And we know from this report and from research that's been done by Susie Orbach and Holly Rubin that's done at the Royal Free, that when their research feeds into this report, that there are huge implications of women's concerns and issues about body image and attachment and bonding with their babies post-delivery. And we know that from 0 to year 2 is very, very important. There was a lot of research, a lot of talk about transgenerational impact of body image on babies, which is quite interesting. And we know that early attachment between mothers and babies creates the foundations for mental health for both women and their babies, resilience and flexibility in children. So for us, as healthcare professionals, as midwives, as health visitors, and as family nurses, we are in ideal position to challenge, to support and facilitate women to address their concerns, and how best we can do that. So, if we just very, very quickly look at psychological impacts, the effects of scarring and stretch marks on body image. And again, there's lots of research that's been done, lots of figures that I can quote to you. But 52% of women rate their body confidence as average or below in the postnatal period. 1 in 2 women suffer ongoing psychological issues due to stretch marks and scarring, and that's from a nursing practice survey. 40% of healthcare professionals do not provide enough advice and support, and again, that's from a survey of new mums. 2/3 of women say their health professionals did not raise the subject of stretch marks during the antenatal period in their first pregnancy, and a third of women feel that they should have. And we know that physical, psychological and emotional support is very important when addressing concerns about body image and in particular about stretch marks. So just moving on quickly and asking you some questions. You have a green and a red card. If we use green for yes and red for no, do you feel able to provide patients with advice about their scarring and stretch marks? The majority of women do get stretch marks. Yeah. But if research is telling us that they're not getting the right advice, or they're not even being informed that stretch marks are more than likely going to recur, and we need to bring that subject up, don't we? Yeah. So, did anyone put up their green card? What advice are we giving women about stretch marks? Yeah, keep well hydrated, moisturise their skin. Are we giving any other advice? There doesn't seem to be a national guidance, does there? Okay, so the next question, which is quite pertinent for students. Have you ever received training about the advice that you should give? That's quite sad, isn't it? I work part-time as a lecturer, and I was just thinking back to how do we introduce stretch marks? And we introduce it as a common side effect of pregnancy, and that's how we term it. We talk about constipation, breast changes, stretch marks, weight gain, varicose veins, hemorrhoids, all in 1 2-hour session. And we don't actually talk about advice, do we? And it's interesting when you think that women aren't asking for this advice, they're asking for this information. So I think you identified that there's a lack of training, and maybe there's a lack of confidence on our part about addressing stretch marks. And it's also our embarrassment, their embarrassment. Do you want to mention it? Can you mention it, or should you mention it without giving advice? And that's really important. And again, there's a lack of official best practice guidance. And yes, you're absolutely right in terms of there is insufficient time. When you look at the nice guidance about antenatal visits, how many visits does a multi get? 7. Another gets 10. And I don't know about where you guys work, but where I work, there is lack of continuity antenatally, depending on what service provision there is for antenatal care, what package that or system process that you're trusted using. But there's also lack of continuity postnatal care as well. And there's also selective visiting in postnatal care. So you might be seen postnatally on the ward, discharged 24, 48 hours. Even our sections where I work, they're paid for 24 to 36 hours. They get a visit on their first day home, a visit on day 5, visit on day 10, and that is it. And is that what you're used to as well? So there are huge time constraints on midwives. And it's not just time constraints, it's capacity, is it, and workload. And then how long are you on average spending on a postnatal visit? And probably maximum half an hour. And your focus is on